We are live now.
So, Maitri, I think you will have to start.
Yeah, good morning, everyone. A very good morning. How are you? This is your host, Dr. Maitri Javeri from Department of Computer Science, Gujarat University. ફૂલો ક્યારેય બીજી વાર ખીલતા નથી, જન્મો ક્યારેય બીજી વાર મળતા નથી. મળવા ખાતર તો હજારો લોકો મળે છે, પણ હજાર ભૂલો માફ કરવા વાળા મા બાપ ક્યારેય બીજી વાર મળતા નથી. No elderly person should be like an exile in our families. The elderly are a treasure for our society. We, as responsible citizens of our society and country, are well aware of these moral values. But still, old age homes are flooded with elders, despite their children being in the same city. Why? And when we become senior citizens, and when we will become senior citizens, will we have someone to take care of us? To answer many such queries and understand certain basics, we welcome you to a brainstorming webinar on caring for elders, challenges and opportunities, organized by Women Development Cell and Internal Complaint Committee, Gujarat University. Gujarat University is dedicated toward excellence and growth. I request you all to rise for University Song.
वंदन अभिनंदन वंदन अभिनंदन वंदन अभिनंदन वंदन अभिनंदन वंदन अभिनंदन गुजरात यूनिवर्सिटी आपणी गुजरात यूनिवर्सिटी आपणी विद्यातणु तपोवन वंदन अभिनंदन वंदन अभिनंदन वंदन अभिनंदन वंदन अभिनंदन
राष्ट्र चेतना कला साधना खेल भावना विकसे
विश्व मानवी बनी गुजराती विश्व सकल માં વિલસે સ્નેહ સંપ સહકારની સાથે દેતી તું સન્મતિ સૌના સાથને સંગાથે સૌ સિદ્ધ કરે ઉન્નતિ પ્રેમ બંધુતા સમાનતાના પલ પલ પ્રસરે સ્પંદન વંદન અભિનંદન વંદન અભિનંદન वंदन अभिनंदन वंदन अभिनंदन वंदन अभिनंदन वंदन अभिनंदन वंदन अभिनंदन
Thank you, everyone. Respected patron of the webinar, the Honorable Vice Chancellor, Sir of Gujarat University, Professor Dr. Himanshu Pandya, Sir. Sir is traveling and has conveyed his best wishes for the webinar. Our guest of honor, respected Registrar, Sir, Dr. Piyush Patel. Keynote speaker, Dr. Dilip Mavlankar, Director, Indian Institute of Public Health, Gandhinagar. Dr. Mavlankar is actively involved in research focused on improving management of maternal mortality and emergency obstetric care in rural hospitals. He is also involved in strengthening reproductive health program management, improving quality of care in family welfare, including maternal health, health policy analysis, and implications for program management, management training for health and family planning, government and NGO collaboration in health programs, management of service sector, and quality of services. He has worked as consultant to many agencies worldwide. Distinguished invited speakers, Professor Nasreen Rustam from Chairperson, Center for Lifelong Learning, Mumbai. She is a retired professor from Tata Institute of Social Sciences, fully committed to geriatric care giving and oncological caregiving, developing educational programs for senior citizens and women leadership in higher education, and working against sexual harassment. She has been working across various states of India. Dr. Prasoon Chatterjee, Additional Professor, Department of Geriatric Medicine, All India Institute of Medical Sciences, New Delhi, author of Health and Well-being in Late Life, TEDx speaker, founder Healthy Aging India, working in landmark project on dementia intervention and LASI project, promoter of mass immunization against pneumonia and influenza in elderly people, Mrs. Geeta Kothari from Umang Day Center, Ahmedabad, Professor Dr. Archana Makar, Chairperson Women Development Cell, Professor and Head of the Department of Botany, Bioinformatics and Climate Change Impacts Management, Professor Dr. Jyoti Parikh, Chairperson Internal Complaint Committee and Professor and Head of the Department Computer Science, Gujarat University, Dr. Prachi Motiani, Member Secretary Women Development Cell and Internal Complaint Committee and Assistant Professor, School of Law, Gujarat University, my fellow faculty members and dear students. So Swagatam. Before beginning the webinar, let us all together seek the blessings of Lord Ganesha. Vakratunda Mahakaya Suryakoti Samaprabha Nirvignam Kurume Deva Sarvakaryeshu Sarvada. May I request Dr. Archana Makar ma'am for formal welcome.
Thank you, Maitri. Good morning. I, along with my team, Chairperson ICC Professor Jyoti Parikh and Member Secretary WDC and ICC Dr. Prachi Motiani, welcome you all here to this interactive brainstorming webinar on caring for elders, challenges and opportunities. WDC, as we all know, is committed to addressing relevant issues by way of invited lectures and workshops throughout the year. We also provide a platform to the talented students through our annual interdepartment competitions called Pratibha. It's our proud privilege to welcome our Honorable Vice Chancellor Professor Himanshu Pandya, who is an embodiment of courage, perseverance, and has been the guiding force for students and staff alike. We are very proud of the 5-star rating by GSIRF and once again for the third time emerging as the only state university in the top 100 University of India in NIRF ranking 2022. All this speaks volumes of the vision of our dynamic Vice Chancellor Professor Himanshu Pandya. We heartily welcome our Registrar Sir and Guest of Honor, Dr. P.M. Patel, who has always provided timely support. It is said age is only a number, and we are as young as we feel. But, biologically speaking, as time passes, we all grow old. Socially speaking, elders have different and special needs. Above all, they need care and support. Today, we are fortunate to have with us experts who have been handling this subject in different perspectives. I take this opportunity to welcome Professor Dilip Mavlankar, Director IIPH Gandhinagar, who has been very kind and guided us through this initiative. So we look forward to your keynote address and experiences on the subject. I also welcome Professor Nasreen Rustam Faram, who recently retired from Tata Institute of Social Sciences, Mumbai, and has a vast experience on social needs of elders. I welcome Professor Prasun Chatterjee, who has been handling the medical issues of the elders at All India Institute of Medical Sciences, New Delhi. And we also have with us Mrs. Geeta Kothari, who is providing the elders the much needed emotional support through her initiative called Umang at Ahmedabad. We welcome you all this. I also welcome the faculty members, invited guests, and all the participants in this webinar. We look forward to a great learning experience. Thank you.
Thank you, ma'am. It is said that a leader is who knows the way, goes the way, and shows the way. Just like our Registrar Sir, Dr. Piyush Patel. May I request him to please bestow his blessings.
In the today's seminar, which is organized by WDC ICC, chairperson, Professor Head, respected Archana Madam, respected Jyoti Madam, and Member Secretary of WDC ICC, Prachi Madam Motiani. As I go through the subject, it is very proud for the GU that we are discussing such a emerging topic where care of the elder people because we all, everyone most probably, afraid about the old age. We think that what will happen when we become a very old and we have a lot of time and no one can give us the prime importance. So when we are discussing such a topic with a learned speaker, as go through the this whole card of the invitation from madam, that all the learned speaker have a different topics. So I highly thankful WDC ICC to organize such a seminar, and also thankful as a part of GU office bearer to all those respected madam and sir who is going through discussion in today's seminar. As respected Archana madam told that Gujarat University is five-star ranked and fourth time from top 100 universities in all over the India, and this is only possible under the leadership of Honorable respected Vice Chancellor Sir Himanshu Bhai Pandya Sir and the whole team of the GU admin, GU professors, head directors, and everyone and students. When we are discussing such a brainstorming topic where old age health issues, old age social point of view, and when we discuss this, I think our WDC and ICC really contribute other than their core work. Uh, as an office bearer, once again, I would like to thank the whole team to invite me also. Thank you. Thank you very much.
Thank you very much for your wonderful words. It has always been motivating. Thank you. May I request Dr. Dilip Mavlankar sir for the keynote address?
Namaste. And first of all, I am very happy that as alumnus of this Gujarat University, where I did my MBBS in 1981, I am invited after almost 40 years to address through this online medium on a very important topic of elderly care issues and challenges. I must tell you, if you have heard my background, I largely work on maternal and child health and public health issues like climate change. Now, one may ask why Dr. Mavlankar is called to talk on elderly care. As the director of Indian Institute of Public Health, Gandhinagar, which is now since 2015 the first and only public health focused university, we do Master of Public Health and Master of Hospital Administration as well as PG Diploma in Public Health. Now, it may be useful to remember why and what of public health. Public health is a subject which deals with any of the health and social issues of a community which affects its well-being. And in India, elderly was not so much of an issue for so many years, but last 15, 20 years, it is emerging as a major issue. And I must thank Gujarat University and the Vice Chancellor Dr. Himanshu Bhai, Registrar Patel Sahib, and Archana Madam, Maitri Madam, Jyoti Madam for taking up this issue as an important issue for discussion through Women's Development Cell and ICC, because Women's Development and ICC has a different kind of agenda, but they have broadened the agenda to look at various social issues. And if you know the demography and life expectancy numbers at around independence, our life expectancy was roughly 26 to 30 years on an average. But now our life expectancy has grown to almost 75 years. And with that, women are living longer. And the life expectancy, if you look at middle class, I recently met with all of my friends from my batch of our school. We were talking. We found that most of our friends' fathers died around 60, 65, 70 years of age, whereas their mothers are living right now into 90s. So this is a women development issue as much as a societal issue, because I'm seeing, at least in the middle class in Gujarat, women are outliving men by almost 20 to 30 years, sometimes 40 years. Like my father died at 60, my mother is still living at 84. So in some sense, it is a very important gender issue as well as health and public health issue. Now, why, as a school of public health, we went into this is an interesting story. We have an independent governing council. The last chairperson was Mr. Sudhir Bhai Makad, ex Chief Secretary of Government of Gujarat and ex Education Secretary. So many people in the education field may know him very well. He kept on insisting in board meeting after board meeting that why are you not working on the elderly? For last 5 years, after his persistent request, we couldn't say no to him. He said, whatever is required, we will help you. And he also kindly motivated the Gujarat CSR authority to provide us with the funding to develop a course about 5 7 years ago for the elderly care train people to take training for elderly care. And that time, I must recognize, we formed a National Technical Advisory Committee in which Professor Nasreen and Professor Prasoon kindly agreed. They also visited from Delhi and Bombay in our advisory committee meeting, and two of our professors working with our advisory committee looking at various national and international programs for training of people for elderly care. We developed a 4 month training part time, uh, 2 months of theory and 2 months of practical training for a certificate course in elderly care. And since almost last 4 or 5 years, we have been running different batches in different places of this course, and we have trained more than about 200 people, and already another 50 people are under training in this course. We have produced through this effort the training material in Gujarati, including the training books as well as the PowerPoint slides for the trainers. We are translating this in Hindi. We are also helping, we have helped the NGO in Maharashtra to run this course in Nagpur and Pune. So we are trying to expand this work on a larger scale. So that was our involvement. And with that course, we also learned a lot. What are the challenges and what are the opportunities? Of course, as India's population becomes older and older, we will need more and more home care. uh, why? Because earlier the society and families were looking after the care of the elderly in the homes, and generally the children and families were looking after the elderly. Plus, elderly did not live so long. With medical technology, our many diseases are either prevented or we reduce the complications of those disease, and that is why we are living longer. Now, with increasing age, I'm sure Dr. Prasoon and Nasreen madam will tell you that the human body becomes more and more frail, and given our chronic disease plus our lack of exercise and focus on fitness, our elderly become more and more weak, and in some sense they will require at different points in time support from other people who can take care of them. Given this fact, Government of India has also woken up and has developed national program, as well as the state government are also thinking of developing such efforts to train people. We already have shortage of nurses, and for many elderly people they just need minimum support. We don't really need a full nursing support unless the elderly is really in a bad condition with different kind of tubes, etc., to be taken care of. So there is a huge need, and the need is increasing because now there are several social, economic, and developmental factors where children are no more living with the elderly because of the change in employment. Some children are abroad, some children are in different cities. Second, even if they are in the same city, given the change and westernization of the mindset, many families don't want to take the responsibility of the elderly. Thirdly, many uh, uh, elderly don't have children. The other thing is, given the difference of epidemiological transition, many elderly may not have children who are surviving, because you must be looking at news saying somebody with 50 years of age developing heart disease and dying, or some accident kills somebody's children. Now, in that condition, again, in spite of having children, there is nobody to take care of the elderly. And this problem is there in the developed countries for a long time. And historically, if you see the countries of Western Europe, England, America have developed the culture of elderly homes, which fortunately or unfortunately, it is both sides of the story. We can discuss it further. In India, elderly homes are not well developed. They are not so much supported by the government, and as a tradition people don't like to go to homes because of certain stigma as well as certain lack of social acceptance. So all this means that many elderly will have to be taken care of at home, and in that condition, we will need a large workforce who is trained to take care of the elderly in their physical health as well as mental support kind of situation. Now, with that, there are some models which other countries have tried, where they have made the not only taking care of the elderly but engage the elderly in some kind of social volunteering systems. Because it is one thing to be in your own home and not do anything, but given the knowledge, the skills, the wisdom, and the abilities of the elderly, it is really a shame if we can't use that for the society's benefit. Because if you look at a person who retires at 60 or 65, given our health conditions, at least for 10 to 20 years, that person may be able to do some work. And some of us are, uh, by the time we retire, have either pension or have enough saving that we don't have to earn anything further. In that condition, the elderly can volunteer. It has two benefits. The elderly can contribute to the society with their knowledge, wisdom, and their physical as well as mental abilities, and they will not get depressed. There have been studies in US to show that the elderly who volunteer are much mentally alert and live longer as well as happier than those who don't volunteer, because they become depressed, they become lonely, because there is no social contact in Western countries as much as we have. So, with all this, we must find ways of engaging our elders. Of course, taking care of them is one side. Second is taking help of their knowledge and their abilities and their wisdom, so that the society remains or becomes even better, learning from the wisdom of the elderly. Lastly, this as of now has been a sort of social work or social responsibility, or some kind of a voluntary and philanthropic work. but I am very keen to see that the government takes up this as a major national program of how to engage the elderly, and how, and not to see them as a burden, because if you see, it is unwritten and unspoken. But if you see the experience of COVID, many countries, don't want to name them, in the western world, because it's very not very nice, they had such policies that the elderly could not get the required care, including oxygen, in the elderly homes, and lot of elderly people died in the COVID pandemic. And some people wonder whether this was a sort of unspoken strategy of some nations to get rid of their elderly, which is a very bad thought to even think of, but has happened. uh, with that, I must also tell that somehow we did some studies during COVID to show, even though mortality increased with age, but we were able to protect our elderly homes in much better way than what happened in the West. It is a big area of research, and why I'm highlighting is Gujarat University is producing many masters and PhD studies. We should look at how our elderly homes did not see so much of mortality as compared to the Western countries' elderly homes. So, in somehow, either our elderly are more resilient to this virus, or we provided with such a condition and protection, learning from the West, that we didn't allow the virus to enter our elderly homes. And we have published a paper on this. Prasunji can highlight this area much more. So, finally, I want to end by saying that our elderly should also uh, be politically motivated to force the government to take this as a major national program, as well as the state governments to take up as a state led program of, I'm not saying caring for the elderly, because caring for the elderly, if you talk, we feel that, oh, these are the people who are a burden on the society has to care, that kind of mentality develops. So I would like to call it engaging the elderly in as much knowledge and productive work. It is not making people do them any labor, but taking the best advantage of their knowledge, and in the process also providing them with mental and physical care, and also to have those elderly which are poor having generous pension type of program, where they don't have any social support, so that they don't have to beg, or they don't have to depend upon any body in the society, or even on their own children, because many times it comes to notice that children themselves don't really care for the elderly. And also the third dimension, which you might be reading in the news, which the police has to do, is to physically protect, because when elderly are living alone in the homes, the chance of robbery, the chance of other crimes also start increasing. So even overall, it's not only a health issue, it is an overall issue where the whole society has to, and all departments of government have to work together to provide a secure and enjoyable period for the elderly. With that, let me again thank the Gujarat University and Madam Archana Ben and others for inviting me to this very interesting topic, and giving me opportunity to share my thoughts and experience. Thank you very much. Namaste.
Thank you.
Thank you very much, sir. Thank you for making our audience aware of the societal need for engaging the elderly in various activities and also catering to their emotional, physical, and financial needs. I'm sure more and more people will come forward with this motivation and active support. Thank you very much, sir. May I now request Professor Nasreen ma'am to talk.
Thank you very much. I'm also thankful to Gujarat University for having invited me for this particular webinar. It is the need of the hour, and the more that can be said about the issue, it will be extremely useful for our society. Dr. Mavlankar, in his keynote address, has already mentioned several significant factors, one of which he referred to was the demographic factor, the growing number of elderly that we have in the country. And the UNESCO says that the country which has more than 8% of elderly in its population can be referred to as an aging country. We have already passed the 10% mark. In 2011 itself, we were 100 million plus elderly above the age of 60 years. And by 2025, that means only 2 years from now, we are projected to be at 12% above the age of 60. Please excuse me, my throat is. The important point to note is 71% of our elderly live in rural areas. And all through this particular webinar, I hope that all of us will really keep this point in mind, that many of the programs that we have and many of the discussions that we have seem to center around the elderly in urban areas. And this is not something that has happened only with the elderly as an issue in our country. And in most countries, urban areas, because people there have more education, more literacy, more access to the media, so their problems seem to come forward at a faster rate than those in the rural areas. But the issue of elderly, please let us remember very critically, 71% live in the rural areas. And out of the total rural elderly population, 66% of elderly men are working and 28% of elderly women are working. So the idea of retirement that we have, which also we discuss, and it is a very important point to discuss. But in the rural areas, there is very little like retirement. Elderly people continue to work until their body permits them to. So, I think with this introduction, and one salient point which Dr. Mavlankar emphasized also about the importance of caregivers and training caregivers, and the the Money Life Foundation, an organization based in Mumbai, has estimated that we need to train about 6,25,000 caregivers if we are to have a decent proportion of elderly to the caregiving population. And what does that mean when we say that we have training programs, we have certificate programs? At TISS we have been running a certificate program which functions from Bharuch, Ankleshwar, Aurangabad, Palghar. We used to have batches in Chennai also, but those have stopped. And all these places, the batch size is at the most 20 to 25. So the training of caregivers is not seen by most of our young persons as a very fruitful career. And we have to mobilize students, and that takes a good deal of time. The Masina Hospital in Bombay has completed one batch of training caregivers. So it is not that interest is lacking, but it is also that the awareness is lacking, and employment bureaus can be one very significant point where we can talk about this particular occupation. Uh, with that introduction, I would just like to lead you through some understanding of how does social science see geriatric care. Mainly, it is seen as a medical discipline, and it is discussed mainly in the medical background. I'm very happy that IIPH, being a premier institution, actually initiated work in the area of geriatric care, as also Professor Prasun at AIMS in Delhi. NISD has also been trying to have courses in geriatric care, and we have cooperated with them on a batch or two. Unfortunately, it is not continuing at present, and I think that NISD has a wonderful uh, platform. They have a public sector outreach, and they have connections with the ministry, and for them to take this particular caregiving training in a larger way would be of immense benefit to the elderly population of our country. So, as the slide which is before you is talking about that traditional model of healthcare has always been a medical model. So, when we started looking at geriatric care, again we began to focus on how elderly people fall ill, what is the kind of investigation that is required, and then we apply the remedies, and then again we measure the outcomes to see कि वो जो बीमार था वो ठीक हुआ है या कितना ठीक हुआ है. पर the well-being of the person, well-being meaning that it is a holistic issue. Holistic meaning that we look at the social and the psychological needs of the elderly person. And as many of us already know, physical and mental health is closely interlinked. So, if there is a fall, if an elderly person falls, or if there is lack of mobility, it also is a traumatic experience and hence leads to also mental health issues. Elderly people who suffer from falls, who are unable to leave the home, or who have nobody at home to look after them on a regular basis, also suffer from loneliness. That is again a mental health issue. So, the two things, the physical and the mental, are very closely interlinked. Now, as far back as 74, 75 years ago in 1948, the WHO has already mentioned this extremely important point that understanding of health should be holistic. It should not only be physiological, but also psychological, social, spiritual, and environmental. So, the social science understanding of health is something that is not 2 years old or even 10 years old. It is a much longer one. And this particular slide, we can talk about how uh, what we consider as a symptom of illness is actually not the only symptom or the cause, but it also has social causes. And we also refer to it as social determinants of health. So here I have tried to take an example that we all know that smoking causes cancer, and smoking is a major cause of lung infections and weakening of the lungs, etc. However, smoking or use of tobacco, whether it is pan, gutka, mawa, all of these things actually they don't just come out of the blue. They can also be from peer influence. They can also be by such habits being in the family. So the social reasons for why we take pan or gutka or why we smoke are behind tobacco itself. Is the reason is also the social reason of uh, picking up this habit because of our friends, because of our family. Second example is, we all know that overuse of oil and spices can lead to, say, stomach ulcers. But social factors such as food habits, culture regarding food, the kind of diet that we take, all of these are social determinants of why we use oil and spices. Because there are many countries in the world, there are many diets which don't include overuse of oil and spices. But there are some who do. And the reasons for that are again social. So we see that uh, social, psychological, and more than the physiological is what we mean when we talk of holistic health. And in geriatric care, this is something that we really need to take into account. When so the term that is now on your screen is patient centered care. So, patient centered care is where we take into account not just the blood report, the urine report, what does the anatomy say? Is there osteoporosis? Are the bones already weak? We take this into account, but along with that, we also take into account how does the patient, how does the elderly person feel about their illness. So recently I fell down, I fractured my femur bone. Now, that was a shock. I never imagined that while I talk about these things and while I, have geriatric care as one of the areas in which I teach, I never imagined that I myself would become a patient at the age of 67. This is something that my caregivers had to understand about me, because for the first 10 or 15 days I could not get over the shock of the fact that, oh, I have fallen down, oh, I have a fracture, oh, I had to undergo an operation. How come this could happen in my own home when I am myself so careful? How could I fall down? એ થયું જ કેવી રીતે? So the people who were looking after me had to really understand the mental state that I was in. So they could have also told me, હવે એ બધું ભૂલી જાઓ, જે થયું તે થયું, હવે તમે જલ્દી સારા થવામાં ઇન્ટરેસ્ટ લો. So many times we are also very brusque with people who are undergoing health problems. We are not taking into account what that person is thinking and feeling about their illness. And that is what is important in patient centered care, that we are actually thinking of how to manage the person medically. So the medicines are coming on time, the physiotherapy is getting done, and the food is coming, the diet is there, but we are not looking at several of the things that are mentioned on this slide. Are we compassionate and empathetic? Are we responsive to the values? Because health is also a social issue. How we behave when we are not well. All of us, for example, know that in our hospitals, one person is unwell, but there are 4 people visiting that person. This doesn't happen in many Western countries where even sometimes visiting hours are not allowed. In our country, even in the ICU, particular 1 hour is kept for visitors, to be able to come, unless the person is very critically ill. So, and people from the family are still involved in looking after the person. There are 2 reasons for this. One is we also always have a nursing shortage, manpower shortage in hospitals. So a lot of functions, attendants are required with the patient to bring the medicine, etc., and be there when the doctor comes. On the other hand, for us, it is also an emotional situation. If you are an Indian elderly person, it is very difficult for you to be in isolation, receiving good medical treatment but not having contact with your family is extremely traumatic for Indian elderly patients. And there has been research done with the National Health System, the NHS in UK, where they find that actually people recover faster when their family is with them. But their system is so rigid in that sense that they actually have the rules not to allow family for long periods of time to be with the patient. So, patient centered care means also understanding the value system that that elderly person carries, the kind of food that they want to eat. So, for example, there are non vegetarian families who strongly believe that chicken soup is good for the bones. that it is good for, say, overall immunity building. And if a patient who is used to that kind of diet doesn't get it, then they feel that they are not recovering fast enough. In our country, at present, we seem to be in some kind of a transitional stage where we are actually doing allopathic treatment, but our values are very much in the Ayurvedic stream of thinking. So, just to give you an example, हम ठंडे खाने और गर्म खाने में मानते हैं. We believe that some foods create heat in the body and some foods create cold. So after an operation, people are advised not to have what is known as heaty food. So which is something which is difficult to, digest. We are also told that vegetables like brinjal or vegetables like what shall I say, palak are not always good. But if you are following nutrition and diet from the Western point of view, then this is not the understanding. Why I'm emphasizing this point is diet is very closely linked to the recovery process of the geriatric care patient. And diet is very closely linked to your social and your cultural understanding of what you are having and not having. So, for example, banana is considered a cold food. Whereas, on the other hand, if you look at the diet or nutrition charts, they will say only high diabetics need to avoid banana completely. Otherwise, it's a very high source of potassium. And potassium is something that is very good for the cardiovascular system. Mango is considered a hot food, for example, but it's a very nutritious food on the other hand. So, if you don't have diabetes and if you don't have high blood pressure, then many of these fruits, which are otherwise considered cold or hot or heavy on the system, are actually very good for the body. They contain a lot of minerals and vitamins. However, it is difficult to convince somebody with a certain understanding of diet to actually do that. And this is something which a caregiver needs to understand. So, this particular model of patient centered care has been developed, the plain tree model. And in social science, we emphasize this and we also teach this in our training programs that welcome the patient's family and friends. A caregiver should include people. They should welcome people who come to visit the elderly person. They should not consider them as a nuisance and a disturbance. They should consider them as one of the tools in the recovery. Value human beings over technology. So yes, it is important. We have all the required tests. We have the machines and many such things. However, the human touch, speaking with the elderly person and keeping their mind away from pain, these are some very critical things. Enable patients to fully participate as partners in their own care. When you are in a hospital, you don't even have control over when you will have your bath. Now, that is something which is governed by, we all know that, they come early in the morning, 5:30, 6 o'clock, because the night nurse who is going away, it is her duty to give the bed bath or the sponge. And then, the day duty person, they will concentrate on all the medicines and whatever has to be given, etc. Now, there are many people who are not at all comfortable having a cold sponge bath at 5:30 in the morning. However, they have to cooperate because a hospital is a hospital. But what about in your own home? Can you not have control over the time that you will have your breakfast? You may want it earlier or later. Can you not control the time that you want to have a bath or change your clothes? Or do you not have control over how much you will eat and when you will eat? So these are some things which are very important. And the plain tree model says that take the patient's view into account. What Provide flexibility to personalize the care. You may like to be treated in one way, I may like to be treated in another way. So I'm not talking of medicine as treatment, but I'm talking of the caregiving as treatment. Encourage caregivers to be responsive to patients. So I know that in Dr. Mavlankar's course as well as in our course, we have a very large input of communication, how the person should communicate. Because very often we are abrupt, we are terse, and we generally encourage elderly people to, take things in their stride. વી ઓલ્સો હેવ એન અન્ડરસ્ટેન્ડિંગ કે હવે આપણે ગરડા થયા તો થોડું ઘણું તો ખમવાનું જ છે, થોડું ઘણું તો દુખવાનું જ છે, એ તો ઉંમરની વાત છે. એન્ડ વી ડોન્ટ ટેક seriously a patient, a geriatric care patient who is saying, no, my hand still pains, my knee still pains, and we generally say, એ તો ચાલી જશે, હવે બા તમે હવે 2 દિવસ કાઢો, જરા 2 દિવસ કાઢો, ચાલી જશે, થઈ જશે, ઠીક થઈ જશે. So we are generally discouraging our elderly people to talk to us. We feel that it's a complaint, but actually it is necessary for the patient to talk to us, to tell us what is happening to them, and not to shut them up and say, "Ave tame khami lo, jara be dara kadi lo." So that is not the attitude that we want caregivers, whether they are family caregivers or paid caregivers. Communication is very important. And just look at the last bullet point: foster a connection to nature and beauty. So you might think, what does this have to do with recovery? But you will see that from very old times, all of us have the understanding that the concept of a sanatorium, of going away from home to a place where there is openness, where there is the countryside, to get well. This is a very well accepted understanding in our culture, and somehow we have forgotten it. So this whole slide is to do with communication, and I don't think that I need to go through every bullet point, but the last point I want to emphasize, that good communication, talking to the patient, understanding the patient, it has been found that it actually improves the treatment outcome. And when you have sympathetic, empathetic people around you, you feel emotionally stronger and more confident of recovery. Now, these skills should be actively maintained throughout the professional career. So it is not only when you are new and you are first starting off that these things have to be looked into. Your basic communication skills is something that has to stay with you throughout your career. And that is the particular last sentence, that your whole professional career should embody these particular communication skills. Benefits of effective communication, we have already been through this. I just thought that we are generally always giving some advice. We are always giving, when we have these sessions, we're saying કે શું કરવું જોઈએ અને કેવી રીતે કરવું જોઈએ એની ઉપર આપણે જોર. પણ એક્ઝેક્ટલી આપણે શું કરી શકીએ છીએ? So the next 3-4 slides, I have tried to give activity examples, because these are some things which, we are not taught in school and college. So as I said earlier, the medical model, your medicine will come on time, your nariyal pani will come, your temperature will be taken, whatever that you have to eat, we will be making sure of, if exercise or physiotherapy is recommended, then we will be doing that. But communication, socialization, talking to the elderly person, emotional support, these are things which only remain like words. So how do we address psychological and social needs of patients? One is recreational activities. So there are board games, there are cards, there is something called bingo, There, if people know English, etc., then they can play that game called Scrabble. So, in a controlled environment, that means only the patient, along with the caregiver or one or two family members, can actually do many of these things. An important point in recreation is humor. And I'm happy to say that there are actually studies. Now, this particular author, Kalman, has actually done a study of how storytelling and humor is very important and useful. In our culture, actually, all our uh, epics, whether it is the Ramayana, the Mahabharata, all of these epics were actually told first as stories before they were written down. So, storytelling in our culture is an extremely accepted form of emotional support and also of learning, because a lot of our history on all of these epics is also verbal. It is through word of mouth that many of these epics and the stories in these epics have come down. And fortunately, we have many stories about Bal Krishna, Bal Shiva, and Ganpati ji, which have a lot of humor in them, actually. The little pranks that all our gods and goddesses played in their childhood. And many of these stories really help you to relax, and they are a part of your culture. They put, they remove stress. Humor removes stress. And that is why we consider that if caregivers can learn stories, if caregiver which are appropriate to the particular culture, you know, uh, sometimes some jokes are not appropriate to a particular culture. Something that they may enjoy somewhere else, they may not enjoy in our country. So we have to be very careful, with what what we use actually. Now, this slide talks about creative writing, storytelling, and poetry reading. So, a lot of our epics, a lot of the old stories that we have are also written in a poetic form. So, actually, being able to sing and being able to, have music, and that comes in the next slide, these are also very good. Helping psychological and social support for the family. Music. I just talked to you about this, and then you might think that these are all એ તો બધી કહેવાની વાત છે ને બધું મ્યુઝિક ને બધું એટલે શું આ પેલા બોલિવૂડના ગીતો સમજીને એવી રીતે તો કઈ થાય કે these are the kind of, we have a hesitation because this is not something that we use very often. But mind you, people derive a lot of benefit from satsang and from bhajans and from any music which is close to their culture and to what they have. And childhood songs are actually a very good source of making a person feel good. So there may be poetries, there may be songs which your mother, your grandmother sang for you, and we think we have forgotten them, but actually, when we hear them, we almost remember them with the words. And we also remember the faces of the people who sang for us. So, research has actually shown that music in the ICU also helps, rather than the smell of that chlorine and medicines and Dettol and phenyl and all those very medical smells that we have. Actually, music is something that helps. And this particular research that I have referred to over here showed that myocardial infection, people, it resulted in reduction in the heart rate and the respiratory rate. It relaxed people. Then there have been studies on premature infants, and they have been exposed to lullabies, lori, apne lori kahiye, classical music, and reported a beneficial effect on weight gain and reduced length of hospital stay. So you will see that stories, poetry, music, all of these develop emotional support And when doctors and nurses in training can share this, even during the training, it is of great use. Music has also been known to help patients with Parkinson disease, Alzheimer, and Parkinson. Then, very quickly, I will give you an example from visual art, theater and drama, dancing, singing. So, there are very good daycare centers for dementia and Alzheimer patients where they are encouraged to, one of the activities is to dance and to sing. And some popular music is played, some well-known bhajans which we have always grown up with. Such songs are played, such music is played, and you can see that a person even with dementia and Alzheimer responds to that particular music or that particular song. So you may think Nasreen Ben to apra dancing, singing, more than 65 and 70-year-old people, esu nachwana, esu gawana. But you will see that in many parts of our country, singing and movement. What is dancing? Dancing is actually movement with a particular rhythm, to a particular beat. Theater and drama, encouraging people to say take part in mock dramas, etc. And I have seen with my own eyes all these activities being done in daycare centers for the elderly in our country. I'm not talking of any foreign country or foreign old age home or anything, but in our own country, I have seen that encouraging elderly people to participate in this, those old age homes, which every evening help all their mobile residents to come together. જે ચાલી શકતા હોય, જે ફરી શકતા હોય, એવા બધા ગરડાઓને એકઠા કરે છે ને પછી સાંજને ટાઈમે 6 વાગે 5 વાગે કઈ ને કઈ એક્ટિવિટી લે છે બિફોર ડિનર ટાઈમ, જમવાની અગાઉ. those elderly people are much happier in those places. So the last thing that I just want to put before you is, we have been talking a lot about geriatric care and how social science looks at geriatric care. And we have been emphasizing that it is not just the medical model. Medicines are very important, medical care is very important. But if we have to look after all elderly people are not suffering from some disease. Many of the chronic diseases like diabetes, blood pressure, etc., these are going to continue. Cholesterol છે કે એવી કઈ રીતે છે, આર્થરાઇટિસ છે, સાંધા દુખે છે, કે એ તો ચાલવાનું છે, એ મેડિકલ ઇશ્યુ ચાલવા. બટ હાઉ ડુ યુ એન્કરેજ ધ પર્સન ટુ મેન્ટેન their social and psychological needs, and how do you take care of those? That is something that in my particular presentation is what I have tried to bring out. So we have these two subjects, geriatric care, it is like a branch of medicine, and gerontology is the study of aging aspects which are biological, psychological, social, cognitive, and cultural. So looking after elderly people and caregiving for elderly people, we cannot have only a medical course for our caregivers. Understanding, how certain diseases happen, what happens, loss of vision, decrease in hearing, all these things the caregiver needs to understand, change in the bodily functions, etc. But they also need to understand aspects like psychological, cognitive, and cultural. And the myths that we have to dispel those, because many times our treatment of the elderly, for example, we say એ તો સાંભળવાના જ નથી, એ તો rigid છે, એ તો stubborn છે, વાત જ નથી માનતા, પોતાના જ મનનું કરે છે. So there is no use explaining to them. And then sometimes we behave very insulting, we behave in a very demeaning way. Now I have seen, for example, a son or a daughter-in-law of 35-40 years bringing their elderly mother or mother-in-law to the doctor and then saying, doctor, તમે એમને સમજાવો, એ અમારી વાત માનતા જ નથી. That is quite insulting to an elderly person, to complain to the doctor, to say she is a non-cooperative one. and the way in which we refer to them, she is stuck in her old ways, she doesn't want to listen to us. And these are things which actually lower the confidence of the elderly person and delay recovery, and they add to stress in the elderly person. So, gerontological competencies are actually essential for a good geriatrician. If you are going to be a geriatrics doctor, or if you are going to be a geriatric caregiver, then you need to understand other aspects of the person's life. So, a geriatrician has to be a proficient internist, but a geriatrician has to be more than that. So, gerontology explains the older person, we say, in a holistic way. And that was the objective of this presentation, to be able to explain to our interested audience that geriatrics is not only medicine. There is medicine, there is a medical understanding, patients have to be treated and looked after, but there is a very vast area of the psychological and social needs also that need to be understood and need to be included in the caregiver. So, with that, I end my presentation for today and hope that this understanding has been, I have been able to bring across this particular understanding clearly to all of us. Thank you very much for the opportunity. I'm grateful to Gujarat University for inviting me. Thank you very much.
Thank you, ma'am.
Thank you very much, ma'am. It was indeed an informative session. You rightly said that not having contact with family in case of illness is a major issue, and that we have already experienced in COVID times. Family is definitely one of the reasons to recover fast. And so the points that you emphasized under the plain tree model of yours emphasized on caregiving along with medicine giving, keeping up with the time schedule, indulging them in various regenerating activities and creativities, and healthy communication. I'm sure our audience has got many things to take away with them. Thank you very much. In addition to this, if anyone is having any questions, please put them in the chat box of Facebook or YouTube. We will definitely see and try to clear your doubts. Now I would request Dr. Prasoon Chatterjee for the talk.
Yeah, thank you, Professor Archana. Thank you, all the audience, all the guests. I'm sorry, I have very less time because I have some emergency meeting with AIMS director for this COVID task force. COVID is there and COVID is not there. You know, that is the story. So there is some meeting which I have to attend. Let me try to share, if you just allow for 1 minute. I will not speak much. So even I think without slide is also okay. But madam, can I share the slide?
Yeah, please. There is a present button on the lower
My
panel.
PPT is open actually. I don't know. My PPT is already open. So
If you want, our admin will share it. Sayam
अच्छा.
Sagar, can you please share?
I think उनको मुझे बार बार बोलना होगा क्योंकि बहुत शॉर्ट टाइम है. I'll take 10 minutes time. So इसलिए मैंने सोचा अगर मैं if I can share that will be better. So I am in. So I can go directly to screen. Is it like that?
So the PPT is visible.
Okay.
It is showing. It is visible now.
Yeah, it's fine. I think so. As
perfect.
Professor Mavalankar and Professor Nasrin was mentioning, and that geriatrics is not alone patient care. First of all, I'd like to say that I'm also associated with one not-for-profit organization, Healthy Aging India. Through that, what we are doing is we are already running intergenerational school learning model, where we engage retired elderly to teach underprivileged children, which is really giving a commendable result. Initially, we have started in Noida, an outskirt of Delhi, and then we have shifted now in Jharkhand, because situation of school children is not great. School dropout is so. This is a win-win model where we engage retired elderly in their vicinity school, and we take 5 to 8 standard student to share with them experiential learning of the elderly people. That is not only helping to be happy for elderly, but it is also preventing dementia. As I mentioned, my primary area of interest is memory care. And because what is UN, how UN defined, because uh, our goal in life is to practice healthy aging irrespective of our social status. And healthy aging is a life course perspective. It is a continuous process of optimizing opportunities to maintain and improve physical, mental health, independence, and quality of life throughout life course. Next slide, please. So key fact is, as I mentioned, dementia is we cannot be demented as well as practicing healthy aging. That is a very difficult scenario. And dementia is globally, population aging is rapidly increasing, and we'll have a significant number of people who will have dementia. And dementia is not only a problem of that individual, it is a problem of the family. I'm sure in the audience many of the people who has seen patient who are suffering from forgetfulness and its related complications. They suffer from forgetfulness, they have behavioral issue, they have difficulty in activity of daily living. There are many issues. So and it has a major impact in the overall economy also, not only for the individual but also social and societal and national economy. Next, please. So life course perspective is here. I can show you, this is a trajectory of dementia, which has been published in Lancet, which shows that so what are the risk factors. Dementia is something we don't treat, we cannot treat, there are no curable treatment, but definitely we have a lot of preventive methodology. So it starts from early life, less education. You can see, if the slide is okay for you, less education. Then midlife, hearing loss, traumatic brain injury, hypertension, excessive alcohol, obesity, motapan. Then smoking, depression, social isolation, physical inactivity, air pollution, diabetes. So these are all modifiable risk factor. Education, if I start from education, though who are already who has passed early life, still they can start education. Education is a lifelong education. Education has no age bracket. Then you can see, even late life you can start new skill learning, that is education. You can start new language, you can start mathematics. In European country, there are university of third age where retired elderly goes for teaching, learning. So that is still possible. Then hearing loss, traumatic brain injury. Hearing loss, usually we don't we try to avoid hearing aid, considering that this is very inconvenient. But yes, you have to understand, those who are family member are here, that if you don't use hearing aid, then it will be it is a definite risk factor for dementia. Then hypertension. Nowadays we control hypertension better. If you have blood pressure, you definitely go to a doctor. And first and foremost thing, the thing what my previous speaker also mentioned, aging means people will forget. This is not the right thing. उम्र के साथ साथ भूलना is not at all a common thing. There are plenty number of people who are 100 years but their brain is fine. So you have to practice, you have to prevent dementia. So again, alcohol is not good. Obesity, you see, obesity, पहले हमें लगता था obesity is only risk factor for heart attack, brain stroke, but it is also equally important risk factor for dementia. Similarly, smoking, depression. Now late life depression, we usually think that seniors means they will be little mood off mood, they will not talk to people, they will be little isolated, social isolation. Especially COVID has drastically increased these two issue, depression and social isolation. Similarly, physical inactivity, seniors need to exercise more as compared to young people. Though we see in most of the park, seniors walk on and off, we see that they try to mingle socially. So this is very very important, that you have to contribute to the society, you have to mix with the other people in the society. Physical inactivity, you have to do some form of exercise. It can be walking, it can be yoga, it can be other form of exercise, like someone who can able to go to gym, like that. Air pollution, we can't do much, but yes, diabetes again is a modifiable risk factor. Next, please. So I think this risk factor only I'm trying to explain in most of my slide. Can you go to next slide? I think these are the risk factor I have mentioned. Next. So here I'll mention just I have conducted study where we have seen brain stimulation activity. Just previous slide. So brain stimulation activity. This one in early life, much for lateral might be due to people higher cognitive function seeking out. So basically, brain stimulation activity. आपका कुछ भी उम्र हो, अगर आप अपना ब्रेन को द वेरी बेसिक कंसेप्ट इज यूज इट और लूज इट. सो ब्रेन को हमें पॉजिटिवली यूज करना है, चाहे हम किसी अपने अपने पोता से इंटरेक्ट करें, उनसे साइंटिफिक बातचीत करें, उनको कुछ सिखाए, उनको स्टोरी टेलिंग करें जैसे मैंने प्रीवियस स्पीकर ने कहा, और उनके लिए कुछ पढ़ाई करे, खुद के लिए पढ़ाई करे, प्रीचिंग करे, चैंटिंग करे, प्रेयर करे, योगा करे, जिसमें जिसमें आपका ब्रेन यूज होता है, यू डू दैट. दैट डेफिनेटली हेल्प यू टू प्रिवेंट फ्रॉम डिमेंशिया. नेक्स्ट प्लीज. So education level next, hearing loss I have mentioned. Then you just continue because I have brain injury here. सीनियर को भी मैं बोलूंगा, जूनियर भी जो जो सुन रहे हैं यहाँ पे, कि दैट इज द कंसेप्ट ऑफ वेयरिंग हेलमेट व्हेन यू आर राइडिंग द स्कूटर. स्टडी में देखा गया जिनको ब्रेन इंजरी होता है उनको डिमेंशिया होने का चांस बहुत ज्यादा है. एंड बिलीव मी, बिकॉज आई एम द डॉक्टर फॉर एल्डरली पीपल, डिमेंशिया से बदतर चीज कुछ नहीं हो सकता. बिकॉज यू आर देयर बट यू आर नॉट देयर, यू आर टोटली डिपेंडेंट ऑन पीपल, on other people, and you are burdened to the family, and no one wants to be burdened to the family. Next please. हाइपरटेंशन, प्रेशर है तो हमें कंट्रोल करना है. ऐसा कुछ नहीं है कि उम्र के साथ साथ ब्लड प्रेशर थोड़ा थोड़ा बढ़ते जाएगा और ये नॉर्मल है. ब्लड प्रेशर ऑलवेज 120 टू 140 ऊपर का और 80 टू 90 95 नीचे का रहना जरूरी है. नेक्स्ट प्लीज. नेक्स्ट. नेक्स्ट. अल्कोहल, ये मैं फिर से स्ट्रेस यहाँ पे दूंगा. सब लोग पता है, बड़े बुजुर्ग लोग बोलते हैं, तो आपको I understand Gujarat is a dry state, but I understand many other people out of Gujarat also listening to this. So alcohol in any form you have to avoid. और ये छोड़ने का कोई उम्र नहीं होता. आप 40 साल में भी छोड़ सकते हो, 50 में भी छोड़ सकते हो, 60 में भी, 70 में भी. तो जो खराब है उसको हमें छोड़ना है. या तो हम क्वालिटी ऑफ लाइफ के साथ जिए या तो हम बीमारी के साथ जिए, ये हमें डिसाइड करना है. सेम थिंग अल्कोहल के साथ स्मोकिंग भी सेम है. नेक्स्ट प्लीज. इसमें बहुत सारे स्टडी हुआ है. इंपॉर्टेंट इज ओबेसिटी. ओबेसिटी एक नया बीमारी है. बीमारी तो था लेकिन ओबेसिटी का इम्प्लीकेशन डिमेंशिया के साथ हम नया देख रहे हैं. जस्ट लाइक हार्ट अटैक, जस्ट लाइक ब्रेन स्ट्रोक, जस्ट लाइक घुटनों का दर्द, आप अगर ओबेस हो तो आपका नी भी खराब होगी. उसी के तरह डिमेंशिया भी होने का चांस बहुत ज्यादा बढ़ जाता है जो जब कोई लोग ओबीज है. तो ओबेसिटी को कम करने के लिए खान पान में हमें सही से खान पान करना है, एक्सरसाइज करना है, फिजिकल एक्टिविटी करते रहना है जितना आपसे संभव हो. नेक्स्ट प्लीज. नेक्स्ट. स्मोकिंग मैंने बता दिया. डिप्रेशन, ये उम्र के साथ साथ लो मूड इज नॉट नॉर्मल. स्टडी में देखा गया हमारे देश में 60% से ज्यादा लोगों को डिप्रेशन होता है लेकिन ट्रीटमेंट नहीं मिलता. मैं एल्डरली पॉपुलेशन की बात कर रहा हूँ. हमारे पास पेशेंट आता है अलग चीज लेके, बट पता चलता है उनको डिप्रेशन है. सो अगर आपके घर में कोई सीनियर है जो चुपचाप बैठे है, लोगों से बात नहीं कर रहा है, खुद में विड्रॉ कर लिए, यू मस्ट कंसल्ट ए डॉक्टर एंड कैटेगोरिकली यू आस्क फॉर डिप्रेशन. वेदर उम्र के साथ साथ मैं भूलना, उम्र के साथ साथ भूल जाना, उम्र के साथ साथ बातें कम करना, उम्र के साथ साथ लो मूड इज not normal. It is definitely you need to treat them. Next please. Next. Diabetes भी just like hypertension we have to control, you know. Next. सोशल आइसोलेशन, ये सीनियर अगर अकेले रहता है उनके साथ हमें जुड़ना है. उनको भी पॉजिटिव होना है, हमें भी पॉजिटिव होना है. उनको अपना पीयर ग्रुप के साथ, उनको यंग जनरेशन के साथ हमें मिलाना है. इफ वी कैन डू दैट. सोशल आइसोलेशन इज ए मेजर इशू, और जिसका कोई डायग्नोसिस नहीं होता, डॉक्टर के पास भी लोग नहीं जाते, डॉक्टर भी इसका इलाज नहीं. इसमें हमें सोसाइटी को पार्टिसिपेट करना है, इसमें यंग जनरेशन को पार्टिसिपेट करना है, इनमें फैमिली को पार्टिसिपेट करना है. हम सब तरह के लोग इसमें पार्टिसिपेट कर सकते हैं. और हमारा जो सीनियर है उनसे हमें बातचीत करना है, पार्क में देखे तो उनसे दूर नहीं भागना है, उनसे हमें बातचीत करना है. आई थिंक दैट विल बी अ ग्रेट हेल्प फॉर देम. सो वी हैव टू प्रिवेंट सोशल आइसोलेशन which is a major cause of dementia. Next please. फिजिकल इनएक्टिविटी. देखिए स्टडी हुआ है, जो 2 कदम चलते हैं और जो 10 कदम चलते हैं, जो 10 कदम चलते हैं वो बेहतर रहते हैं. तो मेरा घुटनों में दर्द है, मेरा ये प्रॉब्लम है, मेरा मन नहीं है, लेकिन आप कुछ तो करिए. मेरे पास एक पेशेंट है जो 92 ईयर्स का है. कोविड में उन्होंने क्या किया, उन्होंने घर के छत में चलते थे और उन्होंने चलने का जो अमाउंट ऑफ वॉक ही यूज्ड टू डू, पहले वो 5,000 स्टेप लेते थे. कोविड में वो घर के अंदर चलते चलते अभी 10,000 स्टेप लेते हैं रोज. जस्ट इमेजिन करिए. सो दैट इज पॉसिबल. आप कहीं पे भी रहिए, थोड़ा वॉक करिए, थोड़ा पैर को हिलाइए, थोड़ा एक्सरसाइज करिए. बट अगर आपको कोई शरीर में दर्द है तो जरूर एक एक्सरसाइज फिजियोथेरेपिस्ट से मिलके फिर एक्सरसाइज करिए. जल्दबाजी में कुछ करके बीमारी बढ़ जाती है. तो पेन है तो फिजियोथेरेपिस्ट से मिलके तभी करिए. एयर पोल्यूशन वी कैन नॉट कंट्रोल, सो आई विल नॉट डिस्कस. नेक्स्ट प्लीज. नेक्स्ट. सो नेक्स्ट, ये मेरा काम है जो मैंने पब्लिश किया, जिसमें हमने देखा कि कंप्यूटर बेस्ड ट्रेनिंग अगर लोगों को देते हैं, उनके साथ उनका खान पान में थोड़ा मॉडिफाई करते. खान पान में मैं बता देता हूँ. खान पान में हमें कोशिश ये करना है ज्यादा से ज्यादा हम फल खाए. फ्रूट्स यू हैव टू टेक मोर, वेजिटेबल्स यू हैव टू टेक मोर, ये हमें पता है. प्रोटीन के मात्रा खाने में बढ़ाना है, क्योंकि मोस्ट ऑफ द टाइम उम्र के साथ साथ प्रोटीन लॉस होती है और हमारे मसल को प्रोटीन चाहिए. सो प्रोटीन के मात्रा खान पान में हमें बढ़ाना है. रात को कार्बोहाइड्रेट कम खाना है, और जो हमारा पुराना फाइन ग्रेन फास्ट फूड ये सब नहीं खाना है. ये सब आप भाली बाती जानते हो. ऑयल को लेके बड़ा कंफ्यूजन है, बट इवन मस्टर्ड ऑयल इज इक्वली गुड लाइक ऑलिव ऑयल. वी डोंट रिक्वायर टू. तो हमने ये देखा एक्सरसाइज, डाइट और कंप्यूटर बेस्ड ट्रेनिंग से लोगों को भूलने का बीमारी कम हो रहा है. हमने रैंडमाइज कंट्रोल ट्रायल किया. ये एक बहुत सुपीरियर स्टडी होता है. दिस हैज बीन पब्लिश. नेक्स्ट प्लीज. नेक्स्ट. यस. सो समरी यही है कि हमारा जिनको जिनको बीमारी है, कोई बीमारी नॉर्मल नहीं है उम्र के साथ. सारे बीमारी को हमें इलाज करना है. कुछ कुछ इलाज लाइफस्टाइल मॉडिफिकेशन से होगा, कुछ कुछ इलाज के लिए आपको डॉक्टर के पास जाना है. And dementia is not preventable, dementia not treatable. We have to prevent dementia. Next please. So practice healthy aging. मैंने मेरे शुरुआती स्लाइड में आई टोल्ड इट इज अ कंटिन्यूअस प्रोसेस. यहाँ पे जो लोग सुन रहे हैं जो 18 के साल के हैं और जो 80 साल के हैं, सबको हमारा ब्रेन ठीक रखने के लिए अभी से काम करना है. वी हैव टू बी फिजिकली मेंटली एक्टिव. We have to be healthy. We have to stop smoking. We have to stop alcohol. We have to take care of hypertension, diabetes कोई बीमारी. We have to be physically active. आंखों या हेयरिंग में प्रॉब्लम है तो आपको उसको इलाज करना है. ये मेरा किताब है, अगर आप लोग पढ़ना चाहे तो अमेजन में अवेलेबल है. हमारा एनजीओ है हेल्दी एजिंग इंडिया, वहाँ पे भी अवेलेबल है. उस एनजीओ के फंड से हम लोग ट्राइबल बच्चे झारखंड में पढ़ाते हैं. हमने दिल्ली में एक ओल्ड एज होम खोले है, वहाँ पे सीनियर सिटीजन को भी केयर करते हैं. यू क्लिक माई नेम डॉक्टर प्रसून चटर्जी एम्स, यू विल गेट एवरीथिंग. और ये है हमारा नेशनल सेंटर फॉर एजिंग एम्स में, जो फर्स्ट ऑफ दिस काइंड इंडिया में बन रहा है. एक यहाँ पे, एक चेन्नई में. इस बिल्डिंग में हम लोग शिफ्ट हो जाएंगे. यहाँ पे 200 बेडेड डेडिकेटेड जेरियाट्रिक केयर सेंटर होगा. इसमें जितना बड़ा बिल्डिंग आपको दिख रहा है, इसमें सारे ब्रेन से लेके घुटनों का बीमारी तक सब कुछ का इलाज एक ही जगह पे होगा. सीनियर सिटीजन को इधर उधर भागने की जरूरत नहीं होगा. थैंक यू ऑल फॉर गिविंग मी दिस अपॉर्चुनिटी. एंड आई एम सॉरी मैं आपका पूरा मीटिंग अटेंड नहीं कर पा रहा हूँ, बट इट्स अ प्लेजर टू बी विथ ऑल ऑफ यू.
It was indeed a brainstorming session. Thank you so much for being so supportive and taking out time from your busy schedule. We are thankful to be provided with a huge bunch of valuable information and will
Thank you.
definitely avail more information from your book. Thank you very much, sir.
Thank you madam.
Now let's talk about Umang. Umang is an institution that seeks to enhance the quality of life of the elderly and retired people. It strives to do this by providing a vibrant environment in which the elders can interact and socialize with their peers and constructively utilize their time in activities that they find rewarding and fulfilling. So with us today we have Mrs. Geeta Kothari, and I request her to please take on the stage. Thank you.
Good morning, listeners and members of this panel. I would first like to thank Professor Shnaben Makad for organizing this discussion and to Dr. Maudankar for his engagement with Umang, a day center for the elderly that I co-founded in 1987. I must also acknowledge that speaking online is not my cup of tea, but this subject is so relevant that I would set aside my technological limitations to express my views on this interesting symposium. Let's first talk about difference between physical and mental health. As a society, we have learned to focus on physical health. Very recently, we have learned the importance of mental health also. But mental health still remains a matter of shame. Emotional well being is part of this mental health. One would argue that emotional health or emotional well being is not simply the domain of elderly. All generations need to take care of their emotional health. But the way in which issues of emotional health or lack thereof manifest in all elderly population and is different and often ignored until it becomes a recognizable medical condition. The focus needs to be upon everyday care, small ways in which we can teach ourselves how to care about elderly's emotional well being. I must confess this data is observational based on what I deal with at Umang for past 35 years. I do not claim to speak on behalf of Ahmedabad citizens, but 35 years of dealing with senior citizens has given me these insights. In fact, I have been a senior citizen myself since 20 years. The question we face is why are elders struggling with their emotional well being? What are areas and reasons of elderly's emotional struggles? And what are the possible solutions to make the situations better? Prima facie, very often retirement is not taken as a respectable status by the family and to a considerable extent society. Even at a domestic front, second and third generation think that elders don't know many things since their views are outdated. When there is a financial stress, retired elderly are considered to be a burden. Elders can't teach young children since there is a radical change in modern education system. Again, social interactions many times leads to an unnecessary conflicts. Since older generation interactions are not taken by the youngsters in the right perspective. There is one more factor which cannot be ignored. To solve this problem, the two generations choose to live separately and major problem of affording independent residence is difficult to resolve. So, the dilemma is younger generation have no option but to stay with parents, and when this is done mainly out of, and when this is done mainly out unaffordability, there is hidden stress among all generations, which ultimately doesn't result into healthy relationship. So, under this situation, I believe that the solution is to understand each other healthily and to accept each other wholeheartedly. I have a feeling that we have to learn a lot from our parents and grandparents to accept new ways with an open mind. Only then and then there will be a smooth working at all fronts. Umang actually has offered different kind of activities for senior citizens at the center. The day center, we have got games, we have got lectures, we have got drawing, yoga, music, and through these activities, we try to divert their minds to constructive activities. And members spend their 4 or 5 hours of the day very constructively, go home and have very, very uh, useful time. And I think they can really feel happy about their life, and I think their remaining life becomes meaningful, and that is what we have aimed at Umang. Thank you.
So we'll just, yeah. Okay. Maitri? So thank you, Geeta Ben. It has been wonderful to listen to you and to know more about Umang. And I'm sure all those who are in this meeting will definitely make it a point to meet you at some point personally at Umang. I have been fortunate to meet you here in my department, and we had a long chat. I remember. Yeah, Maitri. Yeah, I thought we'd lost you. Yeah, please
Thank you
take
very
over.
much, ma'am. The connection was lost for a while. Uh, Thank you very much, Geeta ma'am, for the wonderful session. I would definitely look forward to visit Umang, and definitely will look forward to provide as many services possible. Thank you, ma'am. Now I request Dr. Jyoti Parikh ma'am to please present vote of thanks.
Thank you, Maitri. On behalf of Women Development Cell and Internal Complaint Committee, Gujarat University, I would like to thank everybody whose contribution has made the organization of this webinar possible. First of all, I would like to thank Honorable Vice Chancellor of Gujarat University for being the pillar of support for all our endeavors. Thank you, sir. I would like to thank Registrar Gujarat University, Dr. P.M. Patel, for his gracious presence, his cooperation, and the support. Thank you, sir. Uh, our country has made tremendous progress in past few decades, but it is a matter of concern that while we are solving many issues, there are some issues which are cropping up which were never there in our culturally rich country, and care for elderly is one such issue. So I would like to thank our today's keynote speaker, Professor Dr. Dilip Mavlankar, who's director of Indian Institute of Public Health, for being the backbone, along with Dr. Mankar, for the organization of this very important webinar. And the issue that has been dealt with in this webinar is very relevant in current time. We would also like to applaud you, sir, for all your focus and efforts towards elderly care. Thank you so much. I would like to thank Dr. Nasreen Rustam Fram, who has been associated with Tata Institute of Social Sciences, for delivering a very informative session, which has helped all of us understand the different perspective of elderly care. Thank you so much, madam. I would like to thank Dr. Prasoon Chatterjee, a renowned doctor with All India Institute of Medical Sciences, for delivering a very informative session to help us understand and deal with dementia, which is a very common problem in elderly people. Not only this, his lecture would help all of us to understand that how important it is to keep ourselves physically and mentally active, so that we can try preventing such a difficult situation called dementia. Thank you so much, sir, for all the information that you have provided with us. I would like to thank Geeta madam, for making all of us aware about a very nice organization called Umang. Madam, આપનું 35 વર્ષનું contribution in elderly care is વંદનીય છે, અને with your this insight and the information that you have given about what all you are doing for elderly care will motivate many people to understand that how important it is to contribute towards elderly care. And whatever we have taken from this particular session, we would also try to see that we try help making this world a better place for elderly people. I would like to thank Professor Dr. Archana Mankad, chairperson of Women Development Cell, for putting in enormous efforts behind organization of this particular webinar. And as a result of this, today we have got to hear and understand the various perspective of elderly care from such renowned speakers. Thank you very much, madam. I would like to thank Dr. Prachi Motiani, the Member Secretary of Women Development Cell and Internal Complaint Committee, for all her help and support. I would feel in my duty if I do not acknowledge the support of our team who works behind the screen: Chinali, Vedehi, Namrata, Dolwala Computer Center, and a technical team from GeoSec, especially Sagar Bhai and Sanyam, for valuable support that they have provided us for organization of this particular webinar. Thank you, Matri, for very gracefully anchoring this webinar. Last but not least, as I always say, a big thank you to all the participants whose participation makes all the effort that has been put in organization of these webinars meaningful. And I'm sure that listening to such renowned speakers who are profoundly contributing towards elderly care, we all must have, got motivated. And this concept of I'm sure that we all believe in taking care of our elders, but listening to these people reinforce this idea that we have to work even harder towards making this world better for all elderly people at our home, not just home, around us in the society. Thank you very much.
Thank you, madam. Thank you, dear audience. The feedback links are open. You can use those links. You can go to those links and then you can get the e-certificates done. Thank you very much for attending the webinar. Goodbye. Take care.